I think this meeting is a great meeting. One of the things that I like the most is the fact that we establish connection between different diseases with similar behaviors. So we talked about smoldering myeloma, we talked about clonal hematopoiesis and myeloid malignancies, and the same for lymphoid malignancies. And even though these are different diseases, they have a lot of commonalities, and we address the questions a little different in each one of those diseases, and I think this is very useful because we learn from the others. And for instance, in this meeting, I actually look forward to the keynote speakers because they bring insights even from solid tumors, from other perspectives that can actually feed us on new ideas on how to address some of the questions. We are talking quite a lot about treatment as well. I think in some ways a little premature because we still don't understand very well the biology of this transformation from precursor stages to malignant diseases, and we need to know more about biology. I actually would suggest that more biologic insights before the trials is something that we need to do.